safety. Number 3, love and belonging. Number 4, esteem. Number 5, self-actualization. Number 1, physiological, food, water, rest. Number 2, safety, security. 3, love and belonging, intimate relationships and friends. 4, esteem, feeling of accomplishment. 5, self-actualization, achieving one's full potential. Priority assessments and prioritizing clients means addressing the physiological needs first. Focus pain. Pain is subjective. Pain is the 5th vital sign. This is following the PQRST model. P, provocation and palpation. Q, quality and quantity. R, region and radiation. S, severity and scale. T, timing and type. There are 6 types of pain: nociceptive, somatic, visceral, acute, chronic, and neuropathic. Nociceptive pain is a result of actual or potential tissue damage. Somatic is cutaneous, which is sharp or throbbing, or deep, which is dull and aching. Visceral is organs and lining of body cavity causing pain. Acute is short duration, chronic lasts 6 months or longer, and neuropathic pain is nerve pain with or without tissue damage. The physiology of nociceptive pain is conversion of pain to stimuli to an electrical impulse through peripheral nerve fibers, then neurotransmitters regulated. This is transduction, transmission, pain threshold, pain tolerance, perception of pain, and modulation. Transduction is conversion of painful stimuli to electrical impulse through peripheral nerve fibers. Transmission is electrical impulses travel along nerve fibers. Pain threshold is the point where a person feels pain. Pain tolerance is the amount of pain a person is willing to bear. Perception of pain occurs in various areas through the influence of thought and emotional processes, and the modulation occurs in the spinal cord, causing muscles to contract, moving body away from painful stimuli. Subjective versus objective data. Subjective is something the patient describes of their symptoms. Objective data is tangible data, which is measurable. The RICE acronym: rest, ice, compress, elevate. The limit for ice packs to be on the skin is no longer than 20 minutes. Do not apply heat or ice directly on the skin. It will cause the skin to burn. There are 3 factors that affect sleep: insomnia, narcolepsy, and sleep apnea. Insomnia, which is most common, is the inability to get an inadequate amount of sleep or feel rested. Women and older adults are more prone. Narcolepsy is sudden attacks of sleep at inappropriate times. And sleep apnea is 5 or more breathing cessations lasting 10 or more seconds per hour during sleep. There are 3 types of nutritional methods: oral, enteral, and parenteral. Oral is through the mouth. Enteral is specific formulas depending on the patient's needs through an NG tube, NJ tube, PEG tube, or G tube. Parenteral is IV through a central line, partial or complete. The long-term consequence of malnutrition is delayed wound healing, osteoporosis, anemia, aspiration risk, and vascular consequences. There are 2 nutrition disorders: bulimia and anorexia. Bulimia is the cycle of binge eating and purging. Anorexia is low body weight, fear of being fat, and restriction of food intake. The types of diets for certain diseases include calorie restricted, This is for clients requiring weight reduction. Sodium restricted for clients with hypertension. Protein controlled is for liver and kidney disease. Calorie protein push is used when there is a need to heal wounds, maintain or increase weight, or promote growth. Diabetic is to manage calorie and carbohydrate increase with diabetes. Renal diet is to manage electrolytes and fluid for clients with renal insufficiency. Fluid volume deficit versus excess. Hypovolemia is fluid deficit. Hypervolemia is fluid excess. Check for early symptoms of dehydration. Assess the blood pressure, weight, bun, and urine. How to determine fluid volume changes is determine body system functions, the body's ability to absorb water, meds, and nutrients, kidney function, dehydration, and overhydration. Input and output balance and imbalance. What does an imbalance possibly represent? Fluid level in the body can be in excess. Taking in too much fluid and excreting too little fluid can also indicate poor kidney function. Electrolyte imbalances: calcium, potassium, sodium, magnesium. For calcium, hypocalcemia, muscle spasms and arrhythmia. Hypercalcemia, cardiac dysrhythmias and changes in skeletal muscle tone. Potassium, hypokalemia, dysrhythmia and weak muscles. Hyperkalemia, cardiac dysrhythmia. Sodium, hyponatremia, changes in mental status and generalized weakness. Hypernatremia, restlessness, muscle twitching, edema, lethargy, and can lead to comatose. Magnesium, hypomagnesemia, hypertension, cardiac dysrhythmias, vascular changes, reduced GI motility, positive Chvostek and Trousseau signs, seizure, and tetany. Hypermagnesemia, bradycardia, hypotension, cardiac rhythm changes. The enema position for constipation is left lateral Sims position. Prevention of constipation: fluid intake, fiber, and exercise. Metabolic acidosis: when the pH is less than 7.35, renal failure, diarrhea, sepsis, and shock. This is diabetic ketoacidosis, and uncontrolled diabetes consists of super high or low blood sugar levels as well as an abnormal A1C level, which indicates how your diabetes is managed. Immobility: DVT assessment and DVT prevention. Drink adequate fluids to prevent DVT. The SCD pumps prevent DVT in bedbound patients. Love knocks: ambulation keeps the blood circulation at a normal level. Signs and symptoms is red, swelling, and hot to touch. The effects of immobility and their consequences. Immobility can put you at a greater risk for developing pneumonia. Physiological changes of elderly clients: reduced muscle strength, sensory deficits, balance issues, slower reflexes, less body water, thinner skin, loss of subcutaneous fat, more chronic diseases, decreased immunity, slower metabolism. Interventions to prevent skin breakdown: turn patient every 2 hours, ensure proper intake of protein, monitor labs, albumin, prealbumin, use moisturizer, and inspect skin daily. Promote proper hygiene, skin clean and dry. Sensory perception issues: hearing loss, vision loss, neuropathy. The get up and go test is the time that it takes, how long the client to go from sitting position to the standing position, taking several steps, and return to the sitting position without using arms for help. What factors can influence diffusion, which is gas exchange? Ventilation and expiration. Normal equals adequate perfusion. Decreased equals inadequate exchange. COPD, asthma, pneumonia, smoking. Hypoxia. What does pulse oximetry measure? oxygen saturation. Perfusion, central versus peripheral, signs and symptoms. Peripheral perfusion is to the peripheral tissue. Central perfusion is to the major organs. The late signs of hypoxemia: cyanosis, cool, clammy skin, use of accessory muscles, retractions, hypotension, and arrhythmias. What raises blood pressure? What raises blood pressure is anxiety, smoking, and alcohol. What lowers blood pressure is dehydration and meditation. Normal temperature is 96.8 to 99.5. Hypothermia is below normal range. Hyperthermia is above normal range. What affects temperature is the time of day, exercise, menstrual cycle, fluids, hot or cold, and age. Therapeutic communication responses: encourage questions and respond to them within a reasonable time. Sit bedside and head of the bed. Do not appear rushed. When you observe the patient or family member expressing feelings, either verbally or non-verbally, encourage him to continue. Expect and accept a wide range of feelings, including anger, fear, and loneliness. Ask yourself, what would you do if this was your family member? Do not compare another person's loss with your own experience. Avoid comments such as, I know how you feel. Instead say, tell me how you feel. Communicating with clients of various cultures. Using interpreters for language barriers. Be aware of cultural differences and religious differences when it comes to healthcare decisions. Verbal versus nonverbal communication. Verbal communication: the use of written or spoken words to send a message. Nonverbal communication, or body language: the exchange of messages without the use of spoken words. Therapeutic communication terms: restating, clarifying, sequencing, reassurance, silence. Barriers of communication: language, stereotyping, offering advice, patronizing language, and false reassurance. There are 4 phases of therapeutic relationships: pre-interaction, orientation, working, and termination. Pre-interaction is collection of data before seeing the patient. Orientation, first contact with the patient. Working is communicate care plan. Patient can express thoughts and feelings. And termination concludes relationship, end of shift, or patient discharge. There are 4 culture terms: assimilation, shock, blindness, and imposition. Assimilation is when you adopt another culture that you're around. Shock is a emotional or mental reaction to new and different cultures. Blindness is inability or refusal to recognize and appreciate the difference between cultures. And imposition is the values, beliefs, or practices that are forced upon a person or group. Complementary and alternative therapies to manage pain include acupuncture and breathing techniques. Ginkgo biloba improves memory. Ginseng increases physical endurance. Chamomile, anti-inflammatory and calming. Echinacea enhances immunity. And aloe is good for wound healing. There are 3 basic safety tips: turning, transferring, and ambulating. Turning relieves pressure if done every 2 hours. Transferring, using a gait belt to ensure safety. And ambulating is getting the proper help: walker, crutch, and proper number of people. Proper body mechanics is lifting the right way and not using your back, bending at the knees and staying close to the object that you are lifting. Centennial events are never events. These are events that should never happen. Common healthcare worker injuries and how to prevent them is back injuries and using proper body mechanics. The purpose of an incident report is to document what happened and to learn from it to make sure it doesn't happen again. Side rail safety is having the upper side rails up. but do not have all 4 side rails up because this will increase the possibility of a fall and be considered a restraint. The OSHA mission is to prevent work-related injuries, illnesses, and death. The National Patient Safety Goals is written by the Joint Commission. They publish this. The World Health Organization mission, or WHO, focuses on promoting health, expanding universal health care coverage, and responding to emergencies. The goal is to reduce the risk for unnecessary harm associated with healthcare to a minimum. Food poisoning. Food needs to be refrigerated within 4 hours. The 4 C's are clean, cook, combat cross-contamination, and chill. There were 2 fall interventions for elderly clients. Home, making sure there are no obstacles like carpet or rug or anything they can trip and fall on, and clinical, make sure the bed alarm and side rails are up, however not R4, and also make sure they are aware of the medication side effects such as drowsiness and risk for blood thinners. There are 3 screening tools, Braden, CAM, and Morse. The Braden scale is used to predict risk for ulcers. CAM, or Confusion Assessment Method, is what we use to help recognize delirium, or cognitive disadvantages. Morse Fall is a set of questions used to determine the level of a fall risk patient. Using Morse Fall score can help identify higher risk fall patients and prevent falls. Once a fall occurs, you report and always reassess the patient. Fire safety. The acronym RACE means rescue, alarm, confine, extinguish, and evacuate. PASS, the acronym means pull, aim, squeeze, and sweep. Restraints should have tried alternative methods first, have a quick release knot tied to the bed frame with 2 fingers, only release 1 restraint at a time for range of motion every 2 hours. Make sure to offer elimination, hygiene, nutrition, hydration, and check circulation every 30 minutes. Nursing diagnosis is scenario and pick nursing diagnosis that applies or is selecting highest priority. Delegations, the 5 rights, task, circumstance, right person, supervision and evaluation, and direction communication. The interprofessional team. The occupational therapist works on active daily livings. Social worker, they do planning discharge, finding facilities, and home health, etc. Speech therapy, they work on swallowing or helping children with speech. Physical therapy, they work on strengthening and moving better. The chain of infection, the causative agent, reservoir, portal of exit, portal of entry, and susceptible host. The causative agent is bacteria, virus, fungus, prion, and parasite. The reservoir is the human, animal, food, organic matter, or inanimate surface, water, soil, insects. The portal of exit means leaving the host. The portal of entry means to the host. This could be the same as the portal of exit. The susceptible host comprise mechanisms immunocompromised, the breaks in the skin, leaving the host more susceptible to infections. The modes of transmission: droplet and airborne, respiratory. GI is Shigella, Salmonella, Hepatitis A. Skin and mucous membranes are HSV and Varicella. Bloody body fluids, HIV, Hep B, and Hep C, and transplacental. There are 4 weather-related casualties: heat, floods, hurricanes, tornadoes. The SOAP acronym is subjective data, objective data, assessment, and plan. The PI acronym, problem, intervention, evaluation. The DAR acronym, data, action, response. To prevent edema, you elevate the feet.